Welcome to my world, the world of the medical laboratory scientist. Health is wealth, knowledge is power. Kidney failure, glomerulopathy versus nephritis. When we talk about glomerulopathy, we are talking of the disease of the glomerulus. The glomerulus perform the main function of filtering the blood so that it can pass out the waste product and the water that comes out or constitute urine. But when there is glomerulopathy, you never know because it's a slow process. It is different from nephritis that immediately you are seeing your pus in your urine or painful urination and what have you, you immediately start getting panic. And so when we now combine the two, that is what is called glomerulonephritis, and which is also very, very dangerous, and it's like you are heading towards the kidney failure. But with glomerulopathy, you have the first problem of urine, a foamy urine, because the urine passes out protein. Protein shows clearly as heavy substance that should not pass through the glomerulus. And when protein starts passing out, it has as surfactants. It makes the urine bubble, and that's what you call foamy urine. So it's a signal, indication of that protein is in your urine. The moment protein can pass out of your urine, there is a fear, the need that the kidney is gradually losing it. The glomerulus is becoming porous, and before you say Jack Robinson, you have reached the end stage of chronic kidney failure, because you have about 5 stages which I shall expose. What's the role of the medical laboratory scientists in all of this? The role is to help one know that there is a disease of the glomerulus. By the time you are doing urinalysis or you have a foamy urine and it's tested, at times it could even be Pence-Jones protein that is coming out, which indicates a multiple sclerosis or even lymphoma. These are problems that are associated with Pence-Jones protein in your urine. There is a way we test for it too. And once that is becoming obvious, the necessary step to take in bringing or reducing the rate at which the damage of the kidney goes on. I shall expose many other things, especially things we do that could also damage the kidney. But the damaging of the kidney, which is glomerulopathy, is slow, like I earlier said, and we don't know that there is an ongoing disease situation of the kidney. And that's why most times when people end up in dialysis clinic, they never knew what was happening. Unlike when you have nephritis that is already showing you signs, because nephritis has to do with inflammation and infection, and those ones speed it up. They speed up the disease. So let us stay on for the slide session, where I shall expose everything for your understanding, and we may gain more. As usual, click the like button, subscribe.
The outline: objective, introduction, comparison, kidney stages, laboratory diagnosis, and finally the conclusion. The objective: to create more awareness of kidney failure, the 5 stages of glomerulopathy, the difference between glomerulopathy and nephritis, and the confirmatory role of the medical laboratory scientists in the definitive diagnosis of these diseases. The introduction: glomerulopathy is a broad term for any disease or condition that damages the glomeruli. The glomeruli is that picture you see, that is the Bowman capsule and what have you. The tiny, delicate network of blood vessels, the probable microscopic, in your kidney, responsible for filtering water and excess fluid from our blood. Common signs include proteinuria. Proteinuria is that which appear as foamy urine, high amount of protein in the urine, lowering the surface tension and causing bubble to form, often resulting in foamy urine. Hematuria, on the other hand, is blood in the urine. It always appears pink, brown, or rusty. And the edema is when you now have the body swelling because the protein has been removed from the blood, and so the blood, the environment is now lodging with water. There is no protein to absorb this water into the blood, and the edema shows swelling, particularly in the face, hand, feet, and ankle due to fluid retention. Hypertension, high blood pressure is also a feature of glomerulopathy. Glomerulopathies can be primary, that is originating strictly from the kidney, or secondary when it is caused by other factors, which includes these other conditions include diabetes nephropathy, where the kidney is damaged caused by long-term high blood pressure. There is also the autoimmune disease when we talk of the body attacking itself. There is the infection too, post-streptococcal infection or viral condition like hepatitis B or C, genetic disorder, almost very similar to the autoimmune, inherited conditions like Harper syndrome or C3 glomerulopathy. Nephritis, on the other hand, typically causes faster and more severe initial kidney damage compared to non-inflammatory glomerulopathy. The primary difference lies in the biological mechanism behind each condition. Nephritis triggers an active, aggressive inflammatory response that quickly destroys renal tissues. Yeah, this photo shows clearly the destruction we are talking about. If you look to the left, you can see pus being labeled an inflammation. That is pyelonephritis. There's pus production and there is inflammation, which when you look at the structure, the cortex, you see is atrophied and the shape is gradually getting different, just like when you now see the final shape of the chronic kidney failure. On the right side, you will see the glomerulonephritis. When it is combined, that is why you have inflammation included and the fibrous capsule. Regardless, glomerulopathy, once it's non-inflammatory, is a very gradual, slow process. Yeah, for better differentiation, let's do the comparison. You look at the glomerulopathy on the left and the nephritis on the right. When you take the primary process, you see that structures or biochemical changes, structural changes are minor, active in the nephritis, destructive inflammation. So the changes are milder with glomerulopathy, while it's very highly destructive. Then the speed of injury is low in glomerulopathy and very rapid in nephritis. Immediate severity, lower immediate risk, progressive filtering water with glomerulopathy, whereas with nephritis is higher immediate risk, causes acute kidney injury. For more comparison, let's look at the urinary signs. You see very foamy urine with glomerulopathy blood. With nephritis is blood leakage, brown, red, pink, and cellular debris. Systemic impact also, you see with the glomerulopathy, there is severe body swelling, edema, and high cholesterol with glomerulopathy. But with nephritis, sudden spike in blood pressure and reduced urine output. And with that, we can say that yes, there is a very glaring difference between the two conditions. Yes, the kidney stages. Stage 1 is normal. You have glomerular filtration rate 90 and the ratio showing 30. Stage 2, the filtration rate is lower and then the ratio is also lower. Stage 3, the same thing. It continues to get lower. 45, then stage 4, the estimated glomerular filtration comes down as low as, and then at stage 5, it is done less than 15, as shown in this. This is how the kidney is seriously damaged, end stage. Laboratory diagnosis for glomerular glomerulopathy, estimated glomerular filtration rate and albumic creatinine ratios are very useful to track the overall loss of kidney function. So as it is even gradual, you could do it at any time, so long as one is aging. Let's say from 40, if life expectancy in your country is 50 something years, by making it to 40, you need to start doing this estimate, especially. And the other test one could do is urinalysis. Very useful for both culture and sensitivity, especially for nephritis. Kidney biopsy is the gold standard for definitive diagnosis. Persistent structural changes lead to inflammation, and chronic inflammation creates permanent scarring, sclerosis. If left untreated, both pathways ultimately lead to chronic kidney disease. That is, when you surely need dialysis or kidney transplant. Other kidney function tests include the EU creatinine bicarbonate chloride, just to make sure that the kidney is in perfect working condition. Finally, the conclusion. The kidney function tests are important in knowing the present state of one's kidney. Just like I will notice that the glomerulopathy is so slow, so it's insidious and the damage continues. But what could damage it? We have told you that there are issues like when you have genetic inheritance. You could also be taking drugs that are very toxic for the kidney, and when you are not hydrating, that is, you allow kidney stones to form, and things that could also harm the kidney. So those things, behavior, lifestyle, what you eat and what you drink, goes through the as waste product through the kidney. You need to wash it so that it's not highly concentrated and becoming toxic, eroding the structure or gradually damaging, creating, and the other underlying conditions like diabetes, obesity, hypertension. But when you are talking of metabolic syndromes, high cholesterol, that could predispose anybody to suffer kidney failure, are what you should watch. Water is like a detoxifier for kidney problems, so it is advisable for one to stay hydrated, especially when one is not hypertensive and could create more work for the heart. Moderation of one's lifestyle will surely go a long way in maintaining a healthy kidney, especially eating less processed food and more antioxidants and vitamins to remove radicals.